Hi, thanks so much. Thanks for having me here today. My name is Elizabeth Buzney, and I work in Boston, Massachusetts, at the Brigham and Women's Hospital as part of MGB Dermatology. Erythropoietic protoporphyria, or EPP for short, is a rare inherited metabolic disorder where patients have a deficiency of the enzyme ferrochelatase. And ferrochelatase, which you may remember from boards prep, is needed for the synthesis of heme. And deficiency in ferrochelatase results in a buildup of protoporphyrins in red blood cells, plasma, the skin, and liver. Protoporphyrin is reactive to light. And so when EPP patients are exposed to light, particularly blue light, they get phototoxic symptoms, and that manifests as intense burning, tingling, and itching of the exposed skin, and then they can get redness and swelling. And long-term exposure to light can cause scarring. And then this phototoxicity is unresponsive to traditional pain and burn management techniques. And that means that patients are typically incapacitated as they wait for the reactions to subside. Because of this, EPP patients actively avoid exposure to light in order to avoid getting these reactions. A reaction can last days to weeks, and further exposure to light and other physical stimuli can actually make it much worse. In practical terms, it means patients are often unable to sleep, children can't be comforted by their parents, and adults are incapacitated. They have to just stay indoors in the dark, waiting for their pain to subside. So it's absolutely terrible. So a rapid onset of phototoxic pain within minutes of exposure to light. And it's not necessarily just sunlight. Some patients with EPP actually are reactive to visible light as well. It can be indoor lights. It can be lights in the OR if they go for a surgery. But the most common is exposure to outdoor light. And it's truly this intense pain within minutes. The pain is described as a deep burning, not really a surface burning, but a deep burning. And it's very disproportionately severe pain relative to what you see on the skin. You may see nothing on the skin at all, which can really throw people off. It can throw off parents and coaches and doctors if the patient, who may be a child, is complaining of severe pain and they don't see anything. Sometimes they may even think that the child is malingering, trying to get out of a sports event. But really, they're having this intense, painful reaction. And then extensive attempts at identifying allergic triggers like grass or other environmental factors don't show anything. The patients may link their symptoms to the time outdoors, but they may actually not have processed it and linked it to light exposure in their own minds. They may be trying to find another trigger, but it's really the light itself.